And patient was having some abdominal pain.
Can you max your screen, or is it maxed and I just can't see it maxed?
Is that better?
That's fine. Yeah.
I can't see the Zoom anymore. I can't see you guys anymore.
It's okay because you're on a presentation mode, so you're
okay. So anyway, so we saw this. There was all the soft tissue around the vessels. It was not taking out the vessel. So we were thinking about lymphoma. And then they asked us if we could biopsy this. And there was some concern because there was like a vessel on every image here. But we decided that there was a window right there.
Wow.
And so we did a biopsy.
Did you do it?
Yeah.
Oh, wow.
So just cut to the, let's see. Oh yeah, so we got the needle closer. We put in, oops. And actually here it looks like the bowel's it's going through the bowel, but it's not. It's so after we got the needle there, the bowel, often I feel like the bowel gets sucked to the needle. So then it looks like it's going through it, but it's actually just next to it. And
we trust you, Aarti. We can tell. Yeah, definitely. No problem there.
And so then we just kind of marched towards that little gap. And anyway, in the end, it came back. So there we are. And it came back pancreatic cancer. So I thought this was really unusual. I thought it was a cool biopsy for us. And then we did 6 FNAs, which came back nothing, and then 3 cores. And it came back pancreatic cancer. So it was, to me, an unusual case because the vein is just completely perineural spread with not taking out the vein at all. So that was my only teaching point about that. Do you guys have anything?
Hey, Aarti, had they already tried to do anything endoscopically?
Yes, and they basically had non-diagnostic FNAs. So usually especially for pancreatic, we will we'll do 2 or 3. We'll usually do 2 endoscopic samplings before we'll go for a CT guided one. Supposedly there's a 17% rate of seeding with pancreatic cancer. We've had several cases of seeding, but sometimes we just need to get it. We've had a couple of other cases that we kept biopsying and nothing ever came back, and then they turned out to be Rosai Dorfman. So that was another one. But this one, it was weird because of the because it wasn't. And actually, if you look, it's basically, I guess, just off the edge of the pancreas, without doing anything to the ducts or the vein.
You do this. I have 2 questions about the procedure.
Yes.
Did you consider doing it by ultrasound or by using CT fluoro, or what was your decision making for doing it like you did?
We did not. We don't actually do that many ultrasound procedures here, and also on the initial scan, not this one, but the initial scan, there was a bowel lying over it. So we often will do it by CT and see if the bowel is out of the way, or maybe hydrodissect the bowel away. In this case, by the time they came for this scan for the procedure, the bowel was out of the way. But I'm sure places that do a lot of ultrasound biopsies probably could have done it also. And then what was your second question? Oh, fluoro. We also often don't use fluoro, but we could have done it with fluoro. I wanted to get the needle there and then give contrast and do an arterial and venous and see exactly where these vessels were. But yeah, usually it doesn't take us that much longer without doing it with fluoro, but we could have done it with fluoro.